Hi, Dr. Joe here to talk about something that came out in June, and then it had another printing in the actual Journal of Clinical Endocrinology and Metabolism, and it's about menopause and menopausal hormone replacement. In 2002, the Women's Health Initiative talked about how bad estrogen really was for women, and in fact 80% of women stopped taking estrogen at that time, right across the board. It really only looked at people who were starting it in their 60s. There were some who really started on postmenopausally, but they were only about 3%. So it really didn't address people's issues about symptoms and what were the risks early in life. Later in life, a lot of things are exaggerated by anything we do. This particular study said, you know, there's some very interesting things that you get an early start. In other words, at the time you take estrogens for menopausal symptoms or amenorrhea or the like, or go a year beyond that. And you will find very major benefits from the whole thing and really big cuts and risks of a lot of disease. So let me just enumerate what they were all about. First of all, there was a 30 to 40% reduction from dying over the next 10 years. That's pretty significant. So the estrogen alone, no progesterone at all, this made it very significant and what made a real difference in all these statistics that are talking about. After you got older, there was a lot of things that didn't work so well. So if you wait too long, the issues of getting something good out of this are really, really diminishing. Diminishing as much in the late 60s as 60%. That's not news in my world, but anyways, that's what it's all about. So what they wanted to do is to start people 50, 59 or earlier, when you first had your symptoms of what you're going to do. There was no increase of heart disease, 90% reduction in menopausal symptoms, and then we looked at a lot of other things that were going on because breast cancer was diminished a lot. That is not what you were told back in 2002. It was increased at that time. That's not what this study shows. There were other things that happened. 10 fewer cases of diabetes, 4 fewer cases per 1,000 in heart disease, 5 fewer bone fractures, 2 fewer colon cancers, all per 1,000 patients. So that's really, really something. But the women who were on estrogen therapy alone had no increase in developing breast cancer, no increase. And when you're on progesterone, it had a little problem here, and they thought they all increased in the progesterone came from the fact that it was cancers that usually wouldn't be there, but they're ignited by the presence of the progesterone. They found this because they did autopsies later on women who found that 7% of women at autopsy had breast cancer. And that's too small to pick up on mammography. So here it is, a virtually complete reversal. Good for your heart, good for your breasts, good to prevent a lot of cancers and diabetes and the like. And as you may well realize, those women who stayed with it have been very well when you augment everything you're getting with all the other things that we do today. The D, we have the arginine that is done. We're in a place where a lot of people really have a good life much later than they thought they would. They really look good and they're living good as well. It's really healthy for you. It's your time.